And hello, everyone. Professor Harrison-Hauer with Fortis Community Health Nursing. This is your week 3 concepts recording, chapter 24, 25, and 26. Sharing my screen. Hopefully you guys are rested and practicing self-care amongst everything else that you have to do. All right, let's get right to it. All right, you guys. So we're talking about this week, chapter 24. You're reading for rural health and migrant health. Rural health and migrant health is another subspecialty of public health, community health nursing that is very important. And then make sure you guys, again, as you're going through your chapters, start with your objectives. You're going to read your objectives, get an idea of what's coming. And then as you go through your readings, take notes, making sure that when you go back after you've completed your chapters and you read all the objectives again, you can do a full circle. It's like, okay, I understand what's going on here. Migrant health, they have so many special population health, community health concerns. And one of the major being access to health care. Any population that has an issue with accessing health care, you can just automatically consider them a vulnerable population. But we're talking about our migrant workers, because thinking about access to health care is a national priority, okay? In all of the 50 states and territories. We want folks to be able to access the care that they need. Not only that, but of course, in a timely fashion to get the services they need will prevent so many potential concerns down the road. So access to health care is a national priority, and that remains unsolved. And so you as nurses going into the profession, just keep that in mind as well. And so you're going to be presented with this. And so access is a problem in rural areas, okay, including the farms that they rely on migrant workers to harvest their crops in urban inner cities. So therefore, they're on the fields, they're working from sun up to sundown, and they have issues because of being able to get into the cities, to get into the care or the doctor's offices. And then you got to look at, there's a scarcity. So there's a lack of health professionals as well in these rural areas. So scarcity of lack of health professionals, poverty is an issue for migrant workers. There's not many health professionals to begin with in the areas where they work. And then they oftentimes live in poverty. They have limited access to the services we talked about, lack of knowledge to even access services, or lack of knowledge of how the healthcare flows to begin with. Migrant workers are faced with that. Social isolation, they usually come in groups and they stay in their groups. And so they're isolated from the rest of the community. And they plague them for many, 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 many generations. So for the migrant worker, language barrier is something else that you may encounter if you work with this population. And so there's cultural differences that come into play. Oftentimes they're from different countries. And you need to know that coming in and be respectful of different cultures, have someone that can translate for you. And then also too, formal rural nursing began with the Red Cross nursing service that's listed there for you. And so we're going to get into talking a little bit more about that. So let me just make sure. Okay, double click here. When you think of rural urban continuum, when you think of rural, think of farm residencies. Usually these are communities that have fewer than 20,000 residents or fewer than 99 people that live there per square mile. So if you were to square a mile, there's 99 people or less that you live there. So think farm residency. That's a good way to remember. And then your urban, the geographical areas are described as non-rural and having a population of more than 99 people per square mile. These are cities with a population of at least 20,000, so that's that. These is all listed in your chapter, but fewer than 50. So between 20 and 50, think of non-farm residents. And then you look at your rural urban continuum residents ranging from living on a remote farm to a village or a small town, to a large town or city, to a large metropolitan area with a core inner city. So a metropolitan area consists of an area of more than 50,000 as their population. A micro area contains an urban core of at least 10,000, but less than 50. So these are all things just to make sure you memorize and understand the definitions, okay? So that when if you were to see this again, you know the difference between rural and urban, metropolitan from micro metropolitan. Okay. And then moving into the rural areas, they're the fastest growing area. Think of the donut effect where people are spreading out. So then you have your center of your donut, folks are getting more and more congested. So they start spreading out that donut. And then that area becomes more and more populated. So the fastest growing rural counties are located in rural regions of the nation along the edges of large metropolitan counties. So the demographers metaphorically refer to this as the donut effect. This is to say that people are moving away from highly populated areas to the outlying regions. And then looking at characteristics, the grain of rural areas are partly due to the attraction of retirees who choose to live in areas that are more scenic, more beautiful, slower pace of life. And then looking at population characteristics and characteristics for rural populations, this is a great slide to be aware of when you're trying to put some characteristics to you when you think of rural populated areas. They tend to be higher, more whites and more likely to be married, fewer years of formal education, tends to be poor, higher risk for being underinsured or uninsured. So these are the characteristics that's listed in your chapter. And then 9 barriers. So when you're looking at anything that has to do with barriers to healthcare and accessing healthcare, I like for you to think of it as, if these are barriers, what could I do to remedy these barriers? What kind of action can I help to decrease these barriers so that folks can get access? And so they're listening to your poverty rates, lack of access to healthy foods. The Rural Health Information Hub identifies 9 examples of these social determinants that are barriers. So these are called social determinants, technically speaking. These 9 barriers are known as social determinants. And so that's listed there for you in your chapter. And then again, health status of your rural residents. They tend to be less likely to engage in physical activity. They usually are, if they're working on the farms from sun up to sun up down, they are busy working. Leisure time just doesn't seem to play into their lives, or wearing seatbelts, or having their blood pressure checked, and having their pap smears, and doing preventative care that they need, such as screenings that we talk about, which is secondary prevention. So then this means that rural residents tend to have more chronic conditions. And then health status of rural residents in continuation is that health providers usually they're part of the community, lived and practice there for decades, and they tend to stay there because they tend to think of the residents as part of their lives, and they oftentimes live there for a long time. But there's also shortages of getting folks to work out, and health professionals to work out in rural areas. And then specifically women's health and maternal and infant health, they tend to have higher rates of infant mortality and maternal morbidity rates, and higher proportion of specialists that are racial minority specialists. I happen to be a women's health nurse practitioner on a rural remote Indian reservation, and I am the only one that looks like me and does what I do. So the overall rural populations have higher rates of morbidities, and because there's lack of specialists like pediatricians, obstetricians, gynecologists. And so victims of assault tends to be what plagues them as well. And then children, of course, being a vulnerable population, and then being in rural areas, they're likely to see a pediatrician for their well child. School nurses tend to do a lot of the care for them. And they tend to also they work on the farms. And so they're, again, like the workers are having a hard time accessing care. And then you got to look at the mental health aspect as well. Often in health services are lacking for mental health in rural residents. They have a delay in seeking care because of the need for specialists to practice that. Unfortunately, domestic violence tends to plague them, and more so alcohol, tobacco, and drug abuse tends to be a concern as well. And then there's all the impact of COVID-19 in rural America really hit them pretty hard as well. And then not having healthcare professionals out there in rural hospitals, and the number of rural hospitals to begin with to access care during COVID was an issue for them as well. So occupational and environmental health, 4 high risk industries found: the forestry, mining, marine related, and agriculture. They tend to, the OSHA regulations that regulate farming and ranching tend to be lacking at some points. Common injuries such as backs and this, that, and the other. Vehicular accidents, trauma, dermatitis, infectious diseases tend to plague them out on the farm, being exposed to certain chemicals. And then the rural healthcare, again, with barriers that's associated with healthcare delivery, to design community health programs that are available, accessible, affordable. That is the dream. Having appropriate nurses and doctors, designing strategies to implement prevention and interventions can really help these guys out. So then as far as the characteristics of the migrant worker that's listed here for you, the seasonal versus those that come in and stay for longer periods of time tend to have a higher rate of undocumented immigrants that's working on the farm, housing concerns, and issues with making sure that you have proper care for them. And then again, listed on the slide is pretty busy, but it just lists the knowledge about how the access services we talked about, transportation, being able to get to the doctor when you're working majority of the day, depression, substance abuse. You make sure you guys know this slide and having a solid understanding of issues in migrant health, anxiety related, children of migrant workers, and again, going to a pediatrician. So you want to build that relationship with your client always, whether they're a migrant worker, homeless, or in the clinic setting, and then be respectful of their values and cultures as well. And knowing that when you're working in the environment, you'll be following different aspects, such as making sure they get mental health and services for older adults, working with that community, that school nurse, and also making sure they get their prenatal care as well. So then case management is it's an important piece of all aspects of population health, community health. So then your case manager folks and making sure that you're connecting them with the resources that they're needing, going back and monitoring any programs that you started. And so specifically for Healthy People 2030, when you're implementing objectives, consider the role factors such as the sparse population, the remoteness of it all, the resources that are lacking, the personnel shortages, all of that. Physical, emotional, and social isolation have to be taken into effect. Consider how are you going to use the limited resources to create such things like mobile clinics to reach more individuals, and just be creative and how you're going to use the limited resources that you have. And then technology comes into play as well, because you can also think of doing things like telehealth and text messaging and video conferencing if they're not able to get into the traditional clinic setting. And let's move on to Chuck chapter 20. You guys, looking for my. All right, you guys, let's get into the chapter 25. Poverty, homelessness, teen pregnancy, and mental health. Now that is a full chapter for you. Again, your objectives that are listed, make sure you have a solid understanding by the time you're done with this chapter. That'll help you a long way with understanding the concepts. So it's important for nurses to understand that their own beliefs about these groups and to be aware of any ethical concerns that you may have. And we discussed this previously because you're working with these guys. And so you want to make sure that you keep your own opinions and beliefs in check. And you never know what is going on, why that person is in that particular situation. So the 4 groups that we're going to talk about, the poor, the homeless, the pregnant teens, and those who are mentally ill, it's complex issue and they're a vulnerable population with their own unique issues and challenges. So in order to really interact with these groups effectively, you want to be effective in anything that you do, it's important for the nurses to identify healthcare needs, barriers to care, essential care services. What do you need to get for these folks? And then realizing that, of course, we're at the tail end of most things, but COVID impacted a lot of people as well. And then there's cultural aspects to beliefs and perspectives that a society values. So these are things to help you to understand that perspectives about individual responsibility for health and their well-being are influenced by many different cultural things as well. To understand poverty and hopelessness and mentalness, homelessness, mental illness, and pregnancy, consider your personal beliefs and attitudes and clients' perceptions of their condition and the social, political, and cultural, and all those factors that influence the client's decisions. So just be aware of that. And then it goes without saying that, and if you live in poverty, it can negatively impact your health status as well and being able to access health care. Their poverty varies depending on the source, listed there for you, such as temporary assistance and SNAP programs, and where persistent in poverty, folks that have lived in poverty for many, many, many years, it tends to negatively impact them if they're in neighborhoods as well that are below that poverty line. And it can be multi-generational, that poverty existed for many generations within their household. So poverty has affected our labor force. It has affected benefits, dwindling Social Security payments to children. These are things to keep in mind when you're looking at what has impacted poverty from a negative perspective. And then these poor health outcomes are often secondary. So they're often related to barriers that impede their access to care. So if we can, again, improve folks' access to getting the care they need, that would just help out a lot, right? Inability to pay for healthcare, lack of insurance, where they're living, language barriers, inability to find providers, inconvenient clinic hours, and it goes on and on and on. Attitudes of healthcare providers toward poor clients, not being aware of that issue that you may have as a provider. So negatively affects on women and children, children or women of childbearing age. Are they getting the care that they need? Are they getting the assistance that they need? Are they getting their screenings? Adolescent women that are going through changes with their bodies, children as they're growing in nutritional needs, older adults, and urban and rural communities. They all can affect someone's poverty, whether you're in the urban area, in a rural community as well. If you're not able to access the care that you need, that will affect you so many levels. So poverty can lead to homelessness, okay? That goes without saying. And it's hard to know exactly how many people are homeless. Um, Counting the number of persons who are homeless on a given day a week, this point in time counts. You can do it that way. Some people count folks that way. And then you can also use period prevalence counts, which examines the number of people who are homeless over a given period of time to get an idea of if you're in a certain area, let's say homeless camps or what have you, you're trying to get an idea of the magnitude of your resources. I mean, your programs. There's definitely homeless definitions defined: crisis poverty, persistent poverty. Crisis poverty, someone's in the poverty guidelines for a short period of time due to being kicked out of their homes, for example. And then homelessness, understanding the concept. So the effects of homelessness on health, just look at the slide there. For example, high rates of TB, being exposed to the elements, and trauma and mental illness, and peripheral vascular disease, and goes on and on and on. Alcohol, tobacco abuse. The at-risk populations that are important to remember are your pregnant women, because they're carrying life that's growing and needs certain services at a certain period of time, and needs for their child as they're growing. Children, adolescents, older adults, veterans, these are all homeless at-risk populations. That's important for us to keep in mind as we go through this chapter and go through our class. For example, teen pregnancy is an area of public concern because of its significant effect on communities, because that teen is often not in school, not able to get to, if they're in school, doctor's appointments, getting the services that they need as they're going through for their prenatal care. Resources to support the special needs of pregnant teenagers are decreasing. Many teenagers who become pregnant are caught in a cycle of poverty, school failure, and the like. We have got to keep them in school. We have got to keep them in school. And so even under the circumstances of adequate finances and supportive and loving families and good birth outcomes, a teen mother must circumvent her own necessary development tasks to raise her child. So if she's a teen parent, she's still growing. She still needs her well child and everything. But she has to take care of her child as well. So reproductive health services to teens require sensitivity. You have to be sensitive to their specific needs, and you have to be confidential with all of this. So history of sexual things that can influence whether a young girl becomes pregnant. She had history of sexual victimization, dysfunctional families, substance use, failure to use birth control, and can influence a young girl's life, and she may become pregnant. She'll need support. She'll need support during, after, in between, all of the times that she's pregnant, from the father, the baby, and the family, and anyone and everyone else. And so when you're looking at trends, the background factors to consider is socioeconomic, where in the location of where things are occurring, if they're in a poverty-stricken area, lack of resources to get to the services they need, sexual activity, use of birth control, things to consider when you're working with the teen, and other factors as well. And then dealing with young men and the fact that they are now out there and getting them to support groups. So services that they need to help them to be the best parent that they can be as well. And then special issues and care for children, pregnant teens, violence, if that's associated with prenatal care, can be challenging as well. They tend to have babies that are born with a low birth weight and prematurity, which can affect that infant's life and that child's life. They're not getting the nutrition they need during the times that they're pregnant for weight gain, and making sure that adequate vitamins and minerals and multivitamins are taken during that time that baby's growing, making sure that they stay in school, that they can finish the education so they can have a chance at a great career in life. Mental illness, switching to mental illness, the prevalence of mental illness problems are really, really, really high. and people are at risk for threats to mental age. It doesn't matter. You could be young, old, parent, not parent. No one's immune to mental health problems. Uh, Deinstitutionalization involving moving many people from state psychiatric hospitals to communities with the goal of improving their quality of life for those persons. However, the community-based services were often not in place when they were moved, when they were deinstitutionalized. And so therefore they just was sent out without connecting with what they needed. You got at-risk population for mental health illness listed there for you. Low income and minority groups are often at risk for mental health issues that may lack access to services. There's that word again. So we've got our primary, we got our secondary, and we have our tertiary prevention. Primary, such things as safe sex education, employee incentives, and housing subsidies. Secondary, meaning soup kitchen screening for depressions. Tertiary, promotion of psychosocial rehab programs. These are the programs in place. Someone has a mental illness that's diagnosed and getting them what they need as well. Your role as a nurse always is to create a trusting, non-judgmental environment, coordinating of services, focusing on prevention, developing a network of support for yourself to be ready for that next client. And then we are going to chapter 24-25. All right, you guys, let's get into chapter 26, alcohol, tobacco, and drug problems in the community. Again, your objectives for you. So tobacco, drug use, alcohol causes more deaths, illness, and disabilities than any other condition. It is a national public health concern. Substance users are not only a risk for personal problems, but also threats to their safety and family members. And it can affect anyone, any age, any race, any part of the community. So factors that contribute to this abuse problem includes a lack of knowledge about the use of drugs. So then that sounds like primary prevention to me, increasing knowledge, the emphasis on illicit drugs, law enforcement rather than the prevention and treatment of abuse and addiction. So overprescription, overprescribing, lack of quality control of illegal drugs, punitive drug laws that label certain drugs as criminals and others as not, encouraging negative attitudes and stigma towards these persons, which we should not stigmatize anyone. So harm reduction is what we want to do as a public health approach. So that's us. That recognizes the following, that addiction is a health problem. It's a legitimate health problem. Any drug can be abused. We want to provide accurate information to help people make responsible decisions about drug use. And people who use alcohol, tobacco, or substance use disorders, they can be helped, so don't give up on them. And then alcohol, tobacco, and other drugs, the current phrase that is a reminder that the leading drug problems involve alcohol and tobacco. Substance use of any substance that threatens a person's health or impairs them or his or her social or economic function. So that's substance abuse. Drug dependence is physiological change in the central nervous system as a result of chronic drug use. So know your definitions. Drug addiction is a pattern of abuse characterized by an overwhelming preoccupation, compulsive use of a drug. So get it a supply, make sure you get a supply, you're preoccupied, gotta have it, high tendency for relapse. So then psychoactive drugs, they affect your mood, your perception, your thoughts, all of that. Often used in enjoyment and recreational, affect your it can affect your central nervous system. These drugs are depressants that reduce the activity of the central nervous system. So it messes with your brain and how you react. Lower the body's overall energy level, reduces sensitivity to outside stimuli. High doses induces sleep, and listed higher doses can cause death. That's a good way to educate folks. Think of your opioids, barbiturates, alcohol, benzoazepine. So then your stimulants, that drugs that increase the activity, nicotine, cocaine, caffeine is a stimulant, energy drinks, amphetamines, any of these can lead to addiction. So in the United States, a standard drug is one that contains about 14 grams of pure alcohol, which is insane, which is found in, for example, 12 ounces of beer has 5% alcohol. 5 ounces of wine have 12% alcohol. 1.5 ounces of distilled spirits have about 40% alcohol. So just know what's in your, let's know that. Smoking can cause cancer, period. The U.S. Surgeon General, who I work for, releases reports about substance use and what have you. But smoking specifically can lead to heart disease, diabetes, COPD, lung diseases, pulmonary diseases, emphysema, chronic bronchitis, increases your risk of tuberculosis, eye conditions, and immune system, rheumatoid arthritis, and so caffeine. We love our caffeine, but you don't want to love your caffeine. So it's widely used psychoactive drug in the world. It's found in coffee, tea, salts, soft drinks, and various medications. Go to the caffeineinformer.com to just know exactly how much caffeine you're putting into your body for a certain particular beverage. Side effects of marijuana use include going into marijuana, dry and reddened eyes, increased appetite, dry mouth, mild tachycardia, drowsiness, anxiety, paranoia, believe it or not. And then the opioid overdose deaths from opioids includes heroin, illicit fentanyl, prescription opioids. 46,000 deaths due to opioid overdose in 2018 alone. So then your natural forms include morphine, codeine, and opium. Your synthetic, your heroin, your methanol, your oxycodone. And then signs as a public health nurse to be wary of for cocaine use. Think about dilated pupils, high levels of energy and activity, excitement, exuberant speech, the immediate effects were off in 30 to 20 minutes. And unfortunately, many of these cocaine users become addicted and run the risk of death. So in addition to effects on the brain, heart, and emotions, there can be effects on the lungs, the respiratory, the GI system. And regular cocaine use for a period of time causes withdrawals. Withdrawal symptoms include things like depression, fatigue, difficulty concentrating, anxiety, increased craving for the drug. It's addiction. And so your meths and amphetamines have a chemical structure similar to adrenaline, popular among those who need to stay awake. So they use that for, alertness and other things. It's easy to make, street drug, very popular in most places. So predisposing and contributing factors, in addition to, I guess, just the specific drug being used, two other major variables influence the particular drug experience. The setting, the set and the setting. The set refers to individual using the drug, and the setting refers to influence of the physical, social, and cultural environments. So all three factors, the drug, the person, and the environment, is the best way to think of it, because all three of these factors should be considered to understand the patterns of drug use by an individual. What particular drug are they using? more about the individual using the drug, and then where the setting influence on their cultural, the environment, how is all of this playing into where they're doing what they're doing. Um, and as far as addiction and genetics concerned, dependence on alcohol and other drugs can occur. They have found a genetic predisposition, genetic factors related to it. Genes are likely contribute to a person's susceptibility to alcohol and drug dependence. And then the environment is a contributing factor. But just because there's a genetic component doesn't mean that you necessarily will become addicted to drugs. Environment also plays a role in it as well, where you are, where you're located. Addiction is, some say addiction is 50% genetic factors, 50% coping skills. So if you have 50% in your genetics, but you have strong coping skills, then that's a good thing. And then also primary prevention, here we go again, harm reduction. Number one, promote healthy lifestyles and resilience. Teaching assertiveness and decision-making skill, teaching stress reduction and relaxation techniques, all other things to help you cope. Primary prevention, education, secondary, drug testing, screening, look at your high-risk groups, assessing for ATOD problems. Tertiary, they have an issue. So there's a condition that exists. So you're getting these guys to their support groups, treatments, whatever they need to detoxify. Your role is to make sure you have a plethora of resources ready and available should this occur. You want to know the different interventions, stages of change. Are folks ready to go into treatment? Where are they with wanting to get help? And you cannot force them to be at a stage of change where they are ready to get help or not ready to get help. It's up to them. You can't force them into being a stage of change such as acceptance, which means they are aware that they have an issue, and if they're not aware, don't know that. That will help you as far as getting them to what they need based on their stage that they want, that they're at. And then ideal roles to assist with tertiary prevention for both the addicted person and the family. So many nurses, I have friends that work in addiction recovery and addiction treatment centers, and they absolutely love it. And you guys, that is your week 3 contest recording. Have an amazing day. Remember, you are resilient. We'll see you in class soon. Have a good rest of your day.